If you want to find out how to prevent Addisonian crisis, you are in the right place. You are going to come across 40 steps to prevent Addisonian crisis. Without further ado, let's go. Hi everyone, thanks for listening to my presentations. Today I'll be talking about 40 steps to prevent Addisonian crisis. And this will form part 7 of 7 when it comes to series on Addison's disease. If you haven't listened to parts 1 to 6, please kindly do, because with that you'll be able to grasp the entire concept of what part 7 is all about. Prevention, they say, is cheaper than treatment, or is cheaper than cure. That is, if it is even curable at all. Why that? Addisonian crisis has a very high mortality rate. So, why not doing everything to prevent Addisonian crisis? Sit back, let's go. In a stable patient, we have to make the diagnosis clear to him or her. Mr. or Mrs. The diagnosis is Addison's disease or Addisonian crisis. And this is what it's all about. We have to make that clear. We must advise against stress. And then we have to teach how to self-administer the rescue medications. For example, glucocorticoids administration subcutaneously could be taught, or intramuscularly, depending on what is acceptable where you are practicing. You have to keep the following always. Please, always keep the following items while traveling. Number 1, medical alert bracelet. Why that? Anyone attending to you anywhere would know your health history immediately, seeing the bracelet that, oh, I have Addison disease. Now you are in coma. They will quickly take the guess you might be having Addisonian crisis. Have a card with information on your health status. That's number 2. Then, like diabetes mellitus patient keeping glucagon, you must keep dexamethasone. Let me repeat. Diabetes mellitus patient might travel on vacation with their bag containing glucagon that they could administer if they become hypoglycemic. You have to keep dexamethasone in a syringe at 4 milligrams mixed with a small saline when you are on a cruise. Avoid trauma as much as possible. Let me explain. You don't belong to the group of people who can indulge in certain activities on account of which we could sustain trauma. Okay, skydiving, climbing up Mountain Kilimanjaro with the risk of probability of falling or not. Don't belong to that group. Still, what you have to do always, watch out about too rigorous exertion. Sorry to say, I'm not limiting your focus in life, but this is not the time to start practicing to become one of the NFL players. Prompt treatment of infection or illness. Please don't delay. Let me explain further. Addisonian crisis could be triggered by infection. In fact, you have to check my channel to find out the causes of Addison's disease or Addisonian crisis. I have that published. Part of it will be infection. I've seen a case on divorce court where a wife was mad at the husband and she was ready to go because the man would not seek medical attention for himself. That is not the case with anyone diagnosed with Addison's disease. If you have infection, if you don't treat it on time, you might be treated into Addisonian crisis. And remember, I've said, not to scare you, but that is the gospel truth, that Addisonian crisis has very high mortality. Keep fludrocortisone 0.1 milligram per hour once daily. You must not run out of it. Even if you have requisition, prescription at the pharmacist, you have to call for more before you run out of it. So you are not the type who will call your doctor or go to pharmacy only when you have taken the last dose. No. You know why? You cannot take the risk of the pharmacist telling you, oh, we're out of it right now, come back next 2 weeks. No. So before you run out of it completely, make sure you have extra at hand. And of course, when you are traveling, get more than enough for the length of time you'll be out of your home. Make sure that electrolytes are acid regularly, particularly your sodium, your potassium, and of course the calcium. Advise against consumption of foods rich in potassium and calcium. Why that? You are prone to hyperkalemia, and you may have hypercalcemia, on account of which we have to treat hyperkalemia on its own or treat hypercalcemia. So why not cutting the consumption down, and we don't need that stress? Please check your blood pressure regularly, and if you want to help yourself further, please have a BP manometer at home, including a thermometer. Keep hydrocortisone and take about 10 milligrams every morning, 5 milligrams in the afternoon, and 2.5 milligrams at the evening time. Or you might decide to keep prednisone at 2.5 milligram to 5 milligram per hour at the hour of sleep. Or dexamethasone 0.5 milligram per hour at the hour of sleep. Take salt generously. Why that? Because we are prone to hyponatremia. But you have to get your electrolyte level acid. Why that? The fact that you are prone to hyponatremia doesn't mean you will actually have it if you don't have it. So remember, I said a few minutes ago that you need to acid the electrolytes regularly. As a matter of fact, you have to become a friend to your healthcare provider. Remember, it's not the type that is out of bounds. You understand what I mean? So compliance with your healthcare provider instructions. Get your early morning plasma ACTH level. Someone is asking me, I'm just a lay person, you're telling me to do this. No, don't worry. When you cooperate with your healthcare provider, your doctor or nurse practitioner, and they are guiding you to do all this, you won't feel that they're asking for too much. That is the essence of this presentation. Let your renin level and activity be determined. If a woman is diagnosed with Addison's disease or Addisonian crisis and has been treated, but later on she's having mood change or impaired sense of well-being, after adequate glucocortisone and glucocorticoids, then we have to look for another agent. What would that be? DHEA, dihydroepiandrosterone. We can give that at 25 milligram or 50 milligram per hour. In case you fall sick or you are stressed out with some symptoms, then increase the glucocorticoids to twice or triple of the normal dose you are taking right now for about 1 to 2 days only. And you have to contact your doctor immediately. Please don't increase the dose of your fludrocortisone. I repeat, never increase the dose of your fludrocortisone. You can increase the dose of glucocorticoids. Never increase the dose of fludrocortisone. And even with that, with the window of probability of being able to increase the dose of your glucocorticoids, I have written it down here. Contact your doctor immediately, even before you do that. But if your doctor instructs you to do that, don't think it's doing something that will kill you. No, it's fine to increase the dosage of glucocorticoids, but it is not fine to increase the dosage of fludrocortisone. Surgery and anesthesia will change your medications appropriately as may be determined by your doctor. Let me explain. You are a known man or woman with Addison disease or already diagnosed with Addisonian crisis in the past, and you are on treatment. Now you have another reason entirely to have surgery. Might be orthopedic surgery. The surgeon and the anesthesiologist will alter the dose of your glucocorticoids. At that point, just follow the instructions. Let all paramedics and doctors know your diagnosis. That's why I said even when you want to go on cruise across the Caribbean or the Pacific, have your bracelet, have your head card. Know why? All doctors know what to do when they know they're dealing with Addisonian crisis or someone with Addison's disease. You'll be back on your daily dose after the surgery. So this page is to encourage you that if you have any other reason for surgery, your medications will be altered for that period. And you'll be back on the regular dosage. Okay, in your bag can contain your money, can contain your card, can contain your passport. It must contain some certain things. In other words, while on the cruise or on the plane, next to you should be your bag containing normal saline 0.9%, fluid giving set, there's amethasone 4 milligram vials or hydrocortisone 100 milligram vials. Why that? You can go into crisis at any time. And when the pilot says, do we have any medical doctor on board? And the doctor says, yes, I'm around. Then they open your bag. They don't need to say, oh, we don't have this, we don't have that. There will be no need of emergency landing. The doctor will administer everything. I'll be back. Probably it will be the time for you to have a meal. You take your meal again and your life is fine. But if you don't have it, there must be emergency landing the next city where that treatment could be given. You will be taught, and you have to teach people around you how to administer all this stuff. Let me explain. Somebody is saying, what? Yes. You are 70-something years old and you have grandkids living with you who are 15, 16 or 20. Teach them, because you can go into crisis at any time. And if you are not living in the city where they can call 911 and they will come immediately within 5 minutes, if you live somewhere 2 hours outskirts of the city on a remote rural area, or does it mean people living in rural areas don't have Addison's disease? They do, of course. So when you have all this and you teach people around you, then of course the phone number of your doctor is always around and your life is secured. But you have to call 911 immediately, or you call your physician immediately, even while you are trying to save yourself with the help of your grandkids. Be very vigilant. And someone is asking about what? Remember, you are on certain medications, particularly glucocorticoids. You know what? That will not be for free. You are taking the glucocorticoids to help you stay alive. There are side effects. So watch out for probability of peptic ulcer disease. Watch out for gastrointestinal bleeding. When you pull, check the toilet before you flush. Is your blood pressure rising now? You are having high blood pressure, glucocorticoids could be responsible for that. Your immunity is down right now. Flu is knocking you down more than before. It's possible because you're on glucocorticoids. Opportunistic infections, oral thrush, skin fungal infections everywhere, or even tuberculosis. If you travel to a region with TB, be careful. Glucocorticoids have suppressed your immunity. Your mood is changing. Yes, glucocorticoids could be responsible for that. Yeah, your mood can change. And you now develop some features, buffalo humps, and truncal obesity, stride. You're already having Cushing syndrome, right? Yes. Remember, your cortisol level was low. That is why they placed you on glucocorticoids. Now it's getting too much. You see life, right? Once upon a time it was low. Now you are getting too much. You can become diabetic. This time around, type 2. Why that? Your glucose level will shoot up because you're on glucocorticoids. Watch out for probability or possibility of osteoporosis. So, when I advise, don't be jumping around, don't be skydiving, don't go on Mount Everest or Kilimanjaro, because if you fall, it's not good for anybody, but it's worse if you're under this situation. Now you are tilted to osteoporosis and you have a fall again. You're going to break many bones. Okay? With that, I've come to the end of these 40 pieces of advice that will help you stay healthy and eventually fulfill the number of years you are supposed to live on earth, even with the diagnosis of Addison's disease or Addisonian crisis, if you can follow them. But in all this, contact your physician. Remember to share, remember to subscribe. I appreciate it.